Oftentimes in life, we tend to overthink things. We overanalyze everything. I know I'm guilty of that, and I know a lot of you are as well. Whether that's overanalyzing things within relationships, with our health, with at our jobs, we tend to overcomplicate things and overthink things. So my goal in this video is to take you and give you a sneak peek as to one of the biggest secrets in healthcare, and that is chiropractic care. Now, hold on a second because I know that a lot of you that are watching this video think, well, chiropractic care, I go there if I have back pain, I go there if I have neck pain or headaches or sciatica. And yes, we do help lots and lots of people with those type of issues. But the truth is, the secret behind chiropractic care and the secret as to why in our practice, we have tons of people that come in for issues like anxiety, ADHD, chronic immune issues, ear infections, sinus infections, allergies, digestive issues. The reason for that is not because chiropractic care is a treatment for those symptoms, but it's because chiropractic care is not about back pain. It's not about neck pain. It's about the nervous system. When a patient comes into our office, one of the questions I ask them every single patient is, what does the nervous system control in your body? And the answer that they most commonly say, and it's the correct answer, is, well, it controls everything. And you're right, it does control. The nervous system controls every single function in our body. Now, when we look at this and we correlate the spine and how the back and the bones and the muscles of the spine, they protect that nervous system, the central nervous system. So it makes sense if you're having problems with your spine, it could be affecting the way your nervous system, the system that controls everything in the body, is functioning, right? So if you're sitting there and you're saying, and somebody has dysfunction in their lower back, that is not only causing pain, it's causing dysfunction in the nervous system. Nervous system dysfunction. Those nerves in the low back, they also go to your colon. They also go to your large intestine, right? So a patient that might be having neck pain and neck issues, they might be having chronic sinus issues. They've had sinus congestion or allergies, and neck pain, right? Well, guess what? Those nerves in the upper neck, they innervate the sinuses. They innervate the musculature in the lymphatic system in the neck, right? So the point is that chiropractic care is not treating any of those symptoms I just messaged or I just listed, but we are assessing the nervous system to see if there's dysfunction in the nervous system that just might so happen to be in an area of the spine where those nerves come out. Now, each nerve in our spine goes to a different part of the body. They go to our muscles, they go to our organs, they go to our glands. So if the nerve signal from the brain coming out of the spine to a certain organ or a certain muscle is not communicating properly back and forth from brain to body, then that is nervous system dysfunction. The cool thing about chiropractic care is that we can measure if there is dysfunction in the nervous system. We have insight scans in our office that measure something called dysautonomia. The autonomic nervous system is the part of the nervous system that controls everything that we don't have to think about. It controls our digestive system. It controls our immune system. It controls our respiratory system and our heart rate regulation. We also have the nerves that control the musculoskeletal system and the adrenal glands and the thyroid gland and all of that. So if we do an insight scan, it is not a diagnostic tool to say, oh, you have nervous system dysfunction at this part, so you must have a problem in this organ. That is not at all the case. But if we find that there's dysfunction in the nervous system, we can then work to improve the way that the nerve is controlling that organ. So we are not here to treat the symptoms. We are here to not only improve the function of the central nervous system, but to also keep the nervous system functioning optimally so that the body can reach its God-given potential in terms of health and wellness. So if you're a person that's been struggling with your health in a number of different ways, doesn't matter what the symptom is, digestion, anxiety, immune system, whatever the case is, and you've tried everything. You've tried you went to the doctor, you've gotten scans and MRIs and lab tests, and you've done allergy tests and sensitivity tests, and everything is coming up normal. Or you found some things that have helped. Maybe you've changed some things in your diet. Maybe you've started exercising or started doing meditation or yoga or whatever the case is, and those things have helped your health situation, but you're still struggling to some effect, I would invite you to try chiropractic care. Let's get you in here, get a scan of your nervous system, and see if, in fact, the nervous system is not quite regulating to its potential. And there is only one profession in the world that corrects nervous system dysfunction at a specific level, and that is chiropractic care. So I would love to be the person to help you see if we can help your health circumstance through neurologically focused chiropractic care. We'll catch you guys next time.